Hi guys, how are you doing? I hope you are doing well and welcome. So today we will continue. In the previous topic, we talked about family planning, and we tackled uh, two methods that are under natural methods of family planning. We talked about the calendar method, and also we talked about abstinence. Today we are going to tackle a third method that is under natural family planning, known as coitus interruptus, or commonly known as withdrawal method. So, coitus interruptus is the practice of withdrawing the penis from the vagina and away from a woman's external genitalia before ejaculation. Okay? It is the practice of withdrawing the penis from the vagina and also away from the female's external genitalia before ejaculation. So why do you have to withdraw the penis? To prevent the sperms from entering the vagina. So this method is not for everybody. It needs both partners to cooperate so that it can be successful. Yeah, it's not 100% effective. Studies show that it is 73% effective, and you really have to cooperate, and both partners, you have to agree, and you have to know. For the male partner, you have to know when are you supposed to withdraw. So if not properly timed, sperm may enter the vagina. So the male partner has to know when to withdraw. Okay, so he has to withdraw his penis from the vagina before ejaculation. So what are the advantages of withdrawal method? Number one, it's free. It's not like the pills, it's not like the coil, it's not like the implants where you have to go to the hospital and you have to pay for them. This method is free. Number two, it's readily available. Let's say a couple you notice later, or maybe you met and you are not prepared, or you don't have family planning method at that moment, and you can't be able to access. What you do, you will use withdrawal method because it's readily available. Okay. Number three, it doesn't require medical attention. Okay. You don't have to go to ask the doctor for instructions. So you can use it anytime without medical attention or medical instructions. What are the risks? There are no related medical risks, but it has, let me call them disadvantages. Number one disadvantage, it does not protect you from sexually transmitted diseases like syphilis, gonorrhea, and HIV. Those are just but a few. So I said earlier that only condoms can protect from both pregnancy and sexually transmitted diseases. So withdrawal method doesn't protect from sexually transmitted diseases. It is condemned by some religions, and also couples feel that it disrupts sexual pleasure. Yeah, this is one this is one common reason why people do not practice this method so much, because couples feel like it disrupts the sexual pleasure. Okay, so before ejaculating, before male ejaculates, there is a fluid, a very clear fluid that is produced before ejaculation called it's called the pre-ejaculation fluid. Some people believe that the pre-ejaculatory fluid contains sperms. So the pre-ejaculatory the sperms are produced by the testes, and the pre-ejaculatory fluid is produced by the corpus gland. So these are two different glands, and the pre-ejaculatory fluid does not contain sperms. So this fluid is produced a few minutes before the male ejaculates, and it's produced so that it will help the sperm to swim freely through the urethra, and it also neutralizes it neutralizes the tube, the urethra, because the urethra, the same tube that urine uses to get out, is the same route that the sperm passes. So the pre-ejaculatory fluid is produced before ejaculation to help neutralize the way, just in case because urine is acidic in nature. So this fluid is produced first, so that it neutralizes the way, so that when the sperm is passing through the urethra, it doesn't the urine is acidic, yeah, so and the acidity might kill the sperm. So the pre-ejaculatory fluid helps to neutralize the acidity in the urethra. Okay, so, and the sperm is used to fertilize the egg. Okay, so pre-ejaculatory fluid does not contain sperm, but if pre-ejaculatory fluid mixes with sperm, okay, left in the urethra in the recent sex, yes, if pre-ejaculatory fluid mixes with sperm that was left along the urethra in the recent sex that you had, then that is when maybe they can mix and that is called cross contamination. So in such like a case, you might get pregnant from the pre-ejaculatory fluid. That means it has to mix with the sperm that was left in the urethra in the recent sex. Okay, I hope you have understood. Some people believe that pre-ejaculatory fluid can cause pregnancy. So I want to make it clear that pre-ejaculatory fluid does not contain sperms, but it can mix with a sperm that was left in the urethra in the recent sex. Okay, if you have had maybe sex, and then now you are going for a second round or another round, so if it chances that there is a sperm that was left in the urethra, then it will mix with the pre-ejaculatory fluid, and you might get pregnant. So you have to be really keen. So you can see that and this fluid is produced a few minutes before a man ejaculates. So that is why we say it is 73% effective. It's not 100% effective. So if you practice it, you have to be really cautious. Okay? Yeah. You have to use it with another method. For example, you can use spermicides. Yes. So that you can be sure that just in case there is a sperm that gets to the vagina, the spermicides can kill the sperm. So yes, that is the simple discussion of withdrawal method. Very tricky. You have to be cautious, and both partners have to cooperate, and you have to understand yourself. A male partner, you have to understand yourself. You have to know when you are about to ejaculate, so that you can withdraw your penis from the vagina. So thank you very much. Let's meet in the next session of learning. Please do not forget to subscribe, do not forget to like, and also to share the video. Thank you.